Yeah, mine too. So I am Angie Braz, and I am the Worksite Wellness Coordinator for Partners for a Healthier Community. I've been in this role for about 4 years now, helping all of you at your work sites to keep your most important asset healthy, right? Your employees. So what I just would really love is we're just going to go around the room and just say your name and what work site you're from, and then also what you hope to gain from today's conference. Just one thing that might come to mind, okay? It's a very casual environment, so don't be nervous or anything in the room. You have municipalities, you have school districts, you have blue-collar work sites, executive work sites, you have people that haven't started a Worksite Wellness program, have well into 5 years into their Worksite Wellness program. So definitely talk to one another during the break if you have time, exchange information, and really connect to learn from one another. So without further ado, Mari Ryan, it's my pleasure to introduce her. I've known her for the past 4 years. She's sort of my guru for Worksite Wellness. I hope she will be your guru for Worksite Wellness. She is the CEO and founder of Advancing Wellness. She is an expert in worksite well-being. She has over 30 years of business experience in various marketing, consulting, and executive roles across a variety of different industries. Ms. Ryan has been creating healthier businesses and impacting the lives of employees through her consulting work and speaking on worksite well-being. Mari earned a bachelor's degree from Lesley University, an MBA from Boston University, a master's in health promotion from Nebraska Methodist College, and is a certified worksite wellness consultant. She is also single-handedly helping launch the Mass Working on Wellness program, which we're going to be talking about today. So if we have a question, we go to Mari. She's amazing. So welcome, Mari Ryan.
Thank you. Whether you're brand new at Worksite Wellness or whether you've been doing this for a long time, there are always some things that we can learn and some practices that we can build. Just as we have practices we build into our personal health, there are practices that we can build into the way we build wellness programs. And that's really what I'm going to focus on today. Angie mentioned that I bring lots of years, there's really lots of gray hair here, of experience to the work that I do, but I've only been in this field for a decade. So when I came to this field about 10 years ago, it was as a result of a career change. You ever get to that point in your life where you go, it's time for something different. I was traveling 3,000 or 6,000 miles a week, every week, for almost 2 years. I was a crispy critter, burnt-out road warrior, and I needed a new job. I needed to do something that was going to have meaning, not just for me, but for the people whose lives that I interacted with and touched. And it brought me to the field of worksite health promotion. But I noticed when I got here, I went to some training programs and got some certifications, and I kept waiting for them to talk about the planning part. Like, where do we build the plan? You know, I'd come out of business. I spent my entire career in business. So where's the plan was what I wanted to know. And I noticed a gap. So I partnered with Larry Chapman. Some of you may know Larry Chapman's name. He is really one of the top consultants in this field, has been for 30 plus years. And he served as my mentor when I first came into this field. And I partnered with him to write an article, and we're going to go through the contents of some of this model that we developed so that you can hear a little bit about what's involved in building a plan for your wellness program. And one of the things I'll also address is some common mistakes that folks make when they are trying to build a wellness program and where these mistakes can hang you up. We heard a few things about people kind of being out there on their own, chairing wellness committees, or being the champion but not having a lot of support, feeling like you may be out there on your own, some of those kinds of things. So let's go through some of these concepts. So where are you headed? Where do you want to go? What do you want to accomplish? Can we get there if we really don't have a plan? So really what we're trying to think about here is, where are we headed? What's our destination? What is it we're trying to accomplish? And if we don't know where we're going, the path may not always be clear. And yes, this is intentionally a little bit fuzzy. Because because it's not always clear where we're going if we really haven't thought about where we want to get to. So that it's not always going to be really clear. So we want to make sure that we're really clear about what our destination is, so that we know where we're going and we have really thought through how we want to get there. So when we think about a plan, my first question to you is, got a plan? How many of you would say you've got a plan? If you're running a Worksite wellness program or contemplating, okay, raise your hands high there. Okay, they've got a plan. All right, we'll talk about why they have a plan a little bit later, okay? They're getting some help with that, so they're smart. All right, got a plan. Not always obvious, and so one of the things we're trying to figure out is this one of the mistakes people make? Absolutely, that they have no plan. So when there is no plan, it's hard to be sure that you're getting to where you wanted to get to. So when I look at some of the research about planning processes, it's kind of interesting how these statistics play out. What they're showing us is that planning is not a regular practice in worksite wellness programs. So this data comes from the organization called Health Enhancement Research Organization. If you are not familiar with HERO, I would strongly recommend you make a note of that, called Health Enhancement Research Organization. You can find them at the-hero.org. And they are an organization that focuses on research around worksite health promotion topics. It's a great resource for you. And what they have shown is that organizations are just not doing planning. Look at the percent that have no formal written or strategic plan, 57%. So this is a piece that we're really seeing that the research is confirming for us is missing. But let's bring it a little closer to home. So I've done a lot of work over the last 8 years with the Massachusetts Department of Public Health. This was a program, a project that was commissioned by the Massachusetts Department of Public Health, and it was done in conjunction with the Worksite Wellness Council of Massachusetts. This benchmarking survey touched about 600 Massachusetts employers and got information about their practices and the work they're doing in worksite wellness here in Massachusetts. You can download this report from the Worksite Wellness Council of Massachusetts website at www.cma.org. It's a great report, shows you what's going on in Massachusetts. This was from 2014. But look at this number. What's going on in Massachusetts? We're just not planning. 90% of the organizations that participated in this survey did not have a plan. Okay? So, what do we do about that? So, but let's first think about, so why do we want a plan? Is this really important to do? Nobody's doing it, so maybe it's not so important, right? Or only a small number are doing it. So let's look at some of the reasons why we want a plan. First is to create effective programming. When you step back and think about what you are going to do, it gives you the opportunity to really be thoughtful about why you're doing things. And I'll talk about this in a little bit more detail. Many of you may have what we often refer to as random programming. Anybody potentially guilty of that? You don't have to raise your hand. But if you're not, without a plan, why you're doing these things, what's your justification for doing these things? And better you do something than nothing, but often we start with random programming, okay? So another reason, return on investment. This is a little bit elusive, you know, it's a little hard to get to, takes a lot of work, but if you are trying to justify having a budget for your program and being able to increase that budget year over year so that you can do more, you're going to have to quantify at some level what you're doing. So this is a goal to aspire to. Not a lot of organizations are doing much, even in terms of being able to measure the impact they're having. Establishing credibility for your program. Are there other areas within your business where you have plans? Of course there are. Look around in your business, right? You go through planning processes, you go through budgeting process, you have goals and objectives and all of those things, right? They're ubiquitous in your business, in your organization, so why don't we do it for our wellness program? So this can give you some additional credibility in terms of you're doing this in the same way you would approach any serious business topic. Okay? The next topic is around the diversity of your workforce. So we recognize today that there's really a lot going on in the workforce and that we have diverse workforces. So we want to make sure that you can address all of that diversity. You need to be aware of it, you need to acknowledge it, and you need to build programming that's going to address the different elements. Do you think that somebody who's my age and might be physically active is going to have exactly the same interests as a middle-aged male manufacturer worker who smokes? No, we're not going to have the same interests. We might have the same, aspire to, living a healthy life, but we may not take the same actions every day. Your workforce is diverse, and you can't do one-size-fits-all programming. Okay, that's the other reason you need a plan. And you have to link with other programs. So what are the programs that are going on within your organization? From a benefits perspective, many of you are from within, the benefits and human resource function within your organization. So what are the other programs that connect to this? You've got your benefits, you've got your EAP programs if you're in a larger organization. You've got other initiatives that are going on, engagement initiatives perhaps from, the human resource function. So really trying to make sure we are connecting and linking to those other elements of the programs. And then if you're in a larger organization, some of you may be in organizations where you have a workforce that you may not think of yourselves as being very large, but you might have some complexities in your workplace, like multiple locations. So, Town of Fairhaven, how many physical locations? 7 physical locations. And do you think the folks in every one of those locations are exactly the same? And the work, it's almost like different kinds of, in some cases, this is why municipalities have so many interesting challenges around managing their workforce. Are the folks at the town hall the same as the DPW, is the same as the police department, the same as the fire department, and the same as, right? Oh my gosh, their job's not quite so easy, right? So no wonder they've got a plan. So this is the complexity. Think about the complexity in your organization. All right, so one thing I want to mention here, again, some more research from the Health Enhancement Research Organization, is that their research shows that organizations that take the time to plan actually have better results in their programs. So what this shows us, if you were looking at things like health assessments, so many of you may be doing some kind of a survey, data collection. A health assessment's a common way to do that. Look at the difference between these numbers for those organizations that have a plan versus the organizations that don't have a plan. Pretty significant differences. The same for reporting improvements in health risks. Huge difference there. And then the reported sustainable impact on medical trend. Medical trend's a little hard to really nudge, takes a long time, set your expectations appropriately, can take 3 to 5 years before you're really going to see any change in your medical trend. And there can be obviously extenuating circumstances. So, just watch those numbers. But again, you're seeing that there's research that shows that indeed having a plan does make a difference. So let's look at this model. So I mentioned this model, that this came from an article that I wrote in 2008 with Larry Chapman. If anybody would like a copy of this article, please just leave me your business card and I'd be glad to send you a copy of this. It's from the American Journal, published in the American Journal of Health Promotion. And what we did here is we looked at this idea of what does it take to really build a plan? And there's 2 elements of this. If you were to start at the top up here, it says obtain the mandate for the wellness initiative and compose your wellness team. Now many of you have already done those steps. Those are kind of the first steps. So if your program's brand new, these are some of the things you need to do first. You need to get your wellness, you need to get management on board, right? It's not going to work, management's not on board. And then you need to establish the organizational structure, the infrastructure that's going to allow the program to really have some arms and legs and feet on the street to help you manage the program. So first time through, you're going to do those 2 things. And then we'll move through and we'll talk about each of these different steps. So we're going to go through the research and discovery stage, identifying needs, formulating goals, selecting interventions, determining anticipated effect of the outcome and measures, preparing your proposal, approval, and then implement it. The thing we most often like to do. This is where we love to go first, is to let's just go do some stuff, right? We usually try to, many times we see folks starting here and skip all these other steps. So this is why I wanted to impress upon you the value of all of these other steps and why these are so important for you to be able to do. All right, so that's the first time through. You're going to take these first 2 steps around obtaining the mandate from management and establishing your wellness committee. So the mandate from management is going to be can be viewed as perhaps the single most important element in building your wellness program. If you do not have management support for your wellness program, what's going to happen? It will fail. It'll go nowhere. Why? Why will it go nowhere?
Get resources.
You won't get resources or time. 2 key things, right? You can't run your program without resources or time. Why else?
No culture support.
No culture support. Really good. Yeah. This has to eventually become part of the culture. Part of this is just what we do here. This is how we function in this organization. It's just what we do. And that comes from that leadership support. So having conversations with your senior leaders, having a sponsor, someone who's designated as the person who's going to be the champion for this to the senior leadership team. When it comes budgeting time, they're going to be the one saying, we need to put money on this. That's what a sponsor's role is. That's why you need the mandate from management. Then you have to define a vision and mission. The vision and mission are the same sorts of things as thinking about really what is our destination. What do we want this to look like when we're done? Have any of you ever built a house? Anybody build a house bottom up? Okay, a few of you, all right. And so did you just go into Home Depot and buy a pile of wood and a couple of bags of sand and concrete mix and you started to build a house, right? No? Didn't work that way? So what did you start with when you wanted to build a house?
You have the land.
You got the land.
You have to make a budget.
A budget, yeah, oh yeah. Oh, you need a budget, there you go, okay?
Architect.
An architect, and what does the architect do?
Plan.
They build your plan for you, exactly, right? The architect builds the plan, right? So, you know, it's not just something that happens randomly. It's very prescribed. The plan creates the vision for where you're going. So this is an important step, again, that many organizations don't do. They don't create the vision and mission statement for what they want to accomplish. And your team. One of the things that we see most often is that this can be a critical success element, that if your team is not strong, well, A, if you don't have one, and B, if it's not a strong team, that your program will falter. And the reason for that is you need someone who's going to be a champion. I heard a lot of you say you're champions. How many of you are champions, right? A lot of you are champions. So you're leading that team. And the team needs to be made up of stakeholders that represent that diversity of your organization. So what's the diversity of the workforce? And are they represented? Do they have a voice in the Wellness Committee? This is really the voice of the workforce. And that's a really important piece. And then when we think about this, this is the one mistake, another one of the mistakes we see often is going it alone. If you feel like it's lonely out there, okay, this is a mistake to make. We often see this happen where, you know, one person, like this is Mari's wellness program. You know, everybody knows that Mari runs this wellness program, right? And then when Mari decides that she's going to go work someplace else, what happens to the wellness program? It walks out the door with Mari because it's not embedded in the organization through the sponsor and the, you know, and the leadership and through the wellness committee. So don't go it alone, please. It can be really lonely out there. We want you to have support. So back to our model. All right, so we're going to focus on these particular steps right now so that you can see what these are. So the first is the research and discovery step. So why do you think we want to ask you to do some research and discovery? Why is this step out here?
What's needed in the workforce.
To know what's needed. Right, so you're gathering some data. right? And there's a lot of different kinds of data that you can gather. So I'm going to show you here one of the other mistakes that we find is that using just one source of data. So you really need to think about multiple sources of data. Where's it going to come from? What elements of information do you need to gather from your organization? And there's lots and lots of different places you can go for data. The question becomes, what are going to be the pieces that are going to be most meaningful for you? So these are some of the different kinds of data that are available to you within the workforce, within your organization. So I'm not going to go through all of them, but I want to just highlight them. So the first is individual. So you can see here, this is things we might often do through a health risk assessment or needs and interest survey. You know, those kinds of instruments are really helpful to understand, you know, what's the individual employee doing and what's their interest. Through your health plan, you often have available health risk assessments. They're going to give you some limited reporting. It's going to be the only challenge with that. And we'll talk about this when we talk about the Working on Wellness program a little bit later. There's a needs and interest survey that's built right into that. That will tell you what employees want to do. Why do we care what people want to do? Right? So they're going to be engaged, of course, right? And let's be careful that we don't mix needs with interests, all right? What they need, okay, you might say, yes, you need to quit smoking. Well, be careful, that's a little judgmental, right? That's a risk, right? That's a health risk that we know of, right? Help me focus on stress. Then I perhaps will then smoke. So we want to think about those. The interpersonal piece, you may have some aspects of this that you can understand within your organization. How does social support work? How's morale? What are informal communication channels? And really being able to understand, you know, sort of what's going on within the organization. The organizational piece, there's a ton of data. There's all kinds of things. Some of it may be easier to get than others. So you might want to look at this list and say, all right, what are the pieces that are going to be most meaningful for us to help us understand? And then there's the environment. The physical environment is an important element about the health choices we make, right? Do you think people who work here, who see that path, the paved path out there that goes for, we don't know quite how far, not far enough probably is the answer, right? So people who work here can just go out on that path. If that path wasn't there, that's an important element of the physical environment that supports and encourages our choices for healthy lifestyles. So the physical environment is really an important element as well, okay? So don't use one source of data, use multiple sources of data. Identifying those needs and interests, that's a really key element here. All right, so what's another mistake we often see? Not knowing what employees want, right? So don't just look at the data that says, oh, we have, you know, claims data, or we have workers' comp data, we have all of these other elements of data to look at, but what do people want to do? That's the piece that's going to really drive the best elements for your programming. And I heard someone say concerns in your introductions, you mentioned concerns about participation. Go back to this. Are you doing what people want to be doing, okay? Then you're going to formulate your goals. So creating these goals is going to be an important element of being able to make sure you get to where you want to. And if you're doing a needs and interest survey, you're going to have, you know, the interests, and you're going to have the let's call them the risk factors. And when you combine those and prioritize those, it's going to be very easy. The goals are really just going to kind of fall out of that. So your goal statements can be, you know, such that you're balancing the prioritizing between the needs and the interests. And then you select your interventions. Now this is often where people start, right? They say, let's do a walking club, or let's do a Biggest Loser contest, right? So they choose their interventions without having done those other steps. And sometimes they work, and sometimes they don't. And anybody ever, you know, you throw a party and nobody showed up? You know, there's, nobody loves me. Well, we feel this way sometimes in wellness programming because we didn't get nearly the response we expected. And that can become because we haven't done prior steps, but we're selecting interventions that may not be what people really want to do. So when we think about this, our next mistake is making sure we have our detailed action plan. So if we have our goal statements and we know where, what we're trying to accomplish, then building a project plan to get there. Can anybody give me an example of where you've used some sort of project plan and task lists and in any context, doesn't matter. Project plan, anywhere? Grocery shopping. Yeah.
That's true.
I'm sure you're not the only person in the room who takes a list when you go to the store, right? Yeah, exactly. You know exactly what you're going for, right? And we use, the problem I think that has become so much of our lives is we forget that we do this. We do this all the time in all of the things, If you're like me, you have a weekend list, right? What am I going to do this weekend? We got this amount of time. What am I going to do, right? We do this all the time. But yet sometimes when we get into the excitement of we're going to go do these interventions, we don't do a really detailed plan. And this is one place I will suggest that if you do nothing else, take the time to plan in detail what your intervention is going to be. My team uses, and this is part of the materials that we've created for the Working on Wellness program, called an intervention planning worksheet. And this worksheet has all kinds of detailed categories of things. If you're going to run a health fair, you need to think about, where are we going to hold it, and who's going to move the tables into the room, and how many chairs do we need, and there's a zillion things you need to think about. You need a detailed task plan. Okay, so don't underestimate the amount of detail. And then also don't forget to use that as a process to go back and, when you're done, debrief on it, right? We have a process we call hoopla, right? What worked, what didn't work, what would we do differently? And by using this hoopla process, what we can do is we can record those things so that if we do this next year, we can look back on that and go, oh, right, remember that thing that just didn't work at all, that we don't want to do? You don't want to be going, wait, what was that? I know there was something that didn't quite work. Don't depend on your memory for that. Write it down and have that as part of your documentation. This is what an intervention planning guide can look like. And again, I'll give you some resources where you can find access to this type of a document. But this is the kind of detail you want to be thinking through in intervention planning. Just look at some of the elements along that left-hand side. What are you trying to accomplish? How does the environment support this? What are the activities? How are we going to evaluate this? These are all the kinds of questions you want to be asking yourself when you're doing this. And then here's some other things. What's the budget? How do we do the delivery logistics? How are we going to market and promote this? Right? Which is such a key element to all of these programs. What are our recruitment tactics? What are we going to use to get people enrolled in this? Which goes hand in hand with your marketing and communication pieces. Are we going to offer incentives? Incentives, we could spend a whole day just talking about incentives. The pros, the cons, do they work? Do they, diminish intrinsic motivation? All kinds of elements here, all right? Do we need any clearances? So how are we going to track things? And what do we do to maintain this? If we're teaching people skills, is there some mechanism we're going to put in place that's going to reinforce those skills later in the environment? All right, so all of these pieces are, a very practical approach to how you can think about planning. And then the next step, measure, measure, measure. To evaluate what you're doing and how you're doing it. All right, this is, again, another key thing that is so often missed when you're doing wellness programs. Get done with the program, it's great, everybody felt good, we're all happy, lots of people showed up, but do we have any way to document what worked, what didn't work, and did we see any change or any result as a result of this program? Once you've done that, you then want to start to prepare a proposal. All these steps are going to lead you to a proposal, to a document that you can take to senior leaders, that you can present to them in a very businesslike and thought-through manner, so that you can make sure that they understand what it is you're trying to accomplish and how it provides value and benefits to the organization. So preparing a formal plan is really an important step. And then you need to implement your plan. And that's the fun part. That's the part that everybody wants to go to first, but this is where the fun is. This is where, and it's also where the work is. Now, we often underestimate actually how much work is involved in implementing programs. So you want to make sure that you really do understand from preparing your task lists and doing those other steps that you can implement your plan. Then you want to have your evaluation step. So evaluation should be, again, a formalized step so that you know what you're measuring, how you're measuring it, and you want to be able to document that so you can look back on this later and really make reference to the important elements that you were able to accomplish and show benefit from the program. All right, and then once we've done that, well, we want to just say this is not a one-time process, right? We want to be doing this. Once we've done it, we're going to do it again, because it's not just a one-time process. It doesn't just happen once, okay? It's the rinse and repeat cycle, okay? You've got to do it multiple times. So this lays the groundwork for it, so it'll be easier the next time you do it, but you have to do it. In an ideal scenario, you want to be linking to the business cycles within your organization. So if you have budgeting processes and planning time that leads up to budgeting processes, get in sync with that flow so that you're following the same business flow and your plan fits with any other business planning that's going on. Okay? All right, so there's the model. Again, I'd be glad to send anyone a copy of this article. If you just leave me your card, I'd be glad to do that. So you can see that what this does is this goes in a circular motion so that we're going through these steps, we're coming back, we're preparing our plan, we're implementing, and then we're going to start all over again. Now let me just mention this program. This model that I had been developing, this was actually part of my master's thesis when I was earning my degree in Worksite Health Promotion and working with Larry Chapman. And just as I was nearing the end, after months of research, nearing the end of my thesis project, I got a call from the Massachusetts Department of Public Health. And they were putting together a program to help employers learn how to build wellness programs. And I said, well, you know, that's really interesting because I think I have exactly what you need, which was a good thing because they needed it in 4 weeks. And we started this program in 2008. It was called Working on Wellness, and we ran this program from 2008 to 2013. In this program, we touched over 62 Massachusetts employers and about 50,000 Massachusetts employees. And this was a fairly high-intense program because we took, each organization came to, there were 4 in-person all-day sessions, and we went through each of these steps, and then you could go back, and for the next 3 months you did all the work associated with those steps, and after 3 months you came back, we went through all the progress you've made, gave you the next steps to do, and so on. And this program worked really well. Some of those organizations, one that we talk about a lot is, in Fall River, is the Family Service Association. Some of you may know this organization. I think they're a couple hundred employees. They were one of the early participants in this program, and they still have a very robust worksite wellness program. So this is a capacity building program to help organizations really understand, you know, all of the steps that we just went through. And this material, there's a workbook, this toolkit, is available online. You can download this toolkit, and some of the tools that I've mentioned, including the steps are just a little bit different than they were described in my article, but you can follow the flow. And there's a whole bunch of tools in here. And I'll talk about some of these tools because that was written a long time ago, and we've replaced some of those tools with newer tools. But the core of what is there is available online. You can just, if you just search on Mass DPH Working on Wellness toolkit, this should come up. And you can download this document and you can refer to it. Don't hit print, it's like 150 pages. So just look at it online. All right, and so where that has evolved to is that it has now evolved to a new initiative that has been funded through the Prevention and Wellness Trust Fund. Some of you are familiar with Prevention and Wellness Trust Fund because some of your local communities, New Bedford here has a community Prevention and Wellness Trust Fund grant. I'm going to pass some cards around and some other materials about this. So Working on Wellness Take 2 is the new version of this, and this program is available to all Massachusetts employers, any organization regardless of your type, so for-profit, nonprofit, and government entities. Size doesn't matter. This is one good place where we can say size doesn't matter. Any size employer can apply to this program. And I'll pass out some handouts as well. And we actually are fortunate to have some folks in the room who are participating in this program. So when I asked at the beginning of the presentation how many of you had a plan, there weren't many hands that went up, which is consistent with our research. But these folks over here from Fairhaven who raised their hand and said they have a plan, and the reason they have a plan is they're part of the Working on Wellness program. So good job for you to be part of this program and have a plan and be living what is, really learning to do all of these steps. The hard part with building a plan is folks don't often know where to start and don't have the tools to do it. And that's exactly what this program does. So this program is intended to bring together really partnering for a healthy workforce between employees, your organization, and your community. So we have an important community emphasis as part of this program. And we have some steps. And this may look familiar. So I'll take you through real quick the steps that are part of this model. We changed the names of them a little bit from when we did them in the first version of the program. So the first step is buy-in. Okay? Does that go to our leadership support and getting support from within the organization? The assessment, collecting data. We have a needs and interest survey and an environmental scan. This program also has resources from UMass Lowell and UMass Medical School that are evaluators, and they take all that data from the evaluation, the needs and interest survey and the environmental scan, and pull that together into reports that are useful for the planning process. Then you do your planning step. We ask you to look at community partnerships. We believe that the community element and tying into this is really important, especially for smaller organizations. There's a lot of resources that you just may not have available within your organization, regardless of size, and that they may be available within the community. For example, we have representatives here today from the YMCA, right? Fabulous organization. Now, I heard a statistic once, tell me if this is right, that 75% of the U.S. population lives within 5 miles of a YMCA. Am I right about that?
Yeah, you are
Okay? So 5 miles is not very far to go, even on your bike. Okay?
Right.
So there's community resources that are available to you. And then implementation, so that fun part that we all like to get to, in being able to implement the program. And then, of course, the evaluation step. We want you to stop and take a look at what you've done. We've provided the tools. One of the key elements about what this program gives you is all of the tools to be able to do this. In essence, this is the cookbook. It gives you every step along the way and tells you what you need to do, but it also gives you all of the tools to do it. And there's something really interesting that's available. Money. A lot of money. Up to $10,000 is available to any organization that applies for this program. The only disqualifier entirely for this would be if your organization has under 200 employees and you have applied for and received the Small Business Wellness Tax Credit. So that's only available to for-profit businesses with less than 200 employees. So if you've already gotten that, you pretty much already have a comprehensive wellness program, so you would not qualify. But up to $10,000, do you think your budget could use a little boost with $10,000? Yeah. So that's what's one of the key elements that's available. We also have, all right, some weird animation. So we've got, this is the training program that is part of this. I described in the original model for Working on Wellness, we met with people in person 4 times a year. For this model, what we're doing, because we're reaching folks all over the Commonwealth, what we're doing is an online curriculum. So you have modules that you go through, you can do them at your computer, each module, different modules for each of the steps that you go through. You also have access to, so there's also webinars, and actually some of you may be signed up for the webinar we're doing this afternoon as part of our expert series. Today's topic is about supportive environment, policies and environmental support that you can use to be able to support your program. There's also technical assistance. So every 2 weeks there is a webinar There's a technical advisor that's assigned to small groups of employers who come into the program, and you then meet every 2 weeks with your technical advisor who's there to support you. So we have 4 technical advisors that are supporting this program. So they're part of our comprehensive team that we've got that are doing this. And this is, the information is on the card and the handout that I gave you, mawow.org. I would encourage you to visit this website because there's a few other resources that are available here. But you could follow us on Twitter, Facebook, join our mailing list to receive information about this webinar series and other information and resources that are made available as a result of this program. And then we are currently accepting applications for the next cohort of organizations that will join the program. The application deadline is June 20th. The application is online, very short, very easy to do, but you need to talk it out, within folks within your organization as to whether you would, it's appropriate. So June 20th will be the deadline for that application. We'll have another group that will have an application deadline in September. So if this is not a good time of year for your business because of seasonal aspects to your business, there's another group that will be starting in October timeframe, so you could apply in September. All right, so this is an incredible resource that's available with money on the table. We'd hate to have the legislature say, how come Massachusetts employers didn't want this money? So we would love to have you be part of this program. And I do just want to mention that there are a number of Southcoast or Southeast, it's not just Southcoast, Southeast Massachusetts organizations that are part of this. So we've had about 19 organizations from the, when I grew up here, we called it South Shore, South and we have some in the room today. So if you want to learn about this program, our folks from the town of Fairhaven can tell you a little bit about what their experience is like. Would you share with this group the comment that you made to me earlier about where you are in the program? Because they're in the first cohort, so the first cohort's already doing the fun stuff at implementation. But would you mind sharing your comment? Because I just loved it.
Just everybody, we all just wanted to start walking groups and do all the things that we wanted to do with the implementation. And when we started going through this process, we were like, oh my God, this is horrible. And to go through all these different training, sit down and do all our goals and visions and try to get everybody together. And we had this whiteboard process that we had to go through. Like, oh, this is horrible. But then as soon as we got to the interventions and everything was approved, we were like, we could have never done that if we hadn't done all the upfront work. So, well worth it. Thank you, Angie.
You're welcome. Well done.
Thank you. Yeah. So we've got, I'm just going to read a few names. Some of these organizations may be familiar in addition to the town of Fairhaven. The South Shore YMCA, we have 2 in our 2 cohorts that we currently have going. We have 2 YMCAs, so think about applying. Habilitation Assistance Corp out of Plymouth, Emerald Physicians, Big Physicians Group, I think like 500 or 600 employees out of Hyannis, Cerebral Palsy of Massachusetts from Stoughton, AccuRounds, which I think is a small manufacturing company in Avon, Bristol Community College is in this program, Brockton Area Multi-Services, Citizens for Citizens, we have somebody here, right? So you're part of this program from Fall River. Crystal Springs out of Assinet, High Point out of New Bedford, Hope Schwone out of Mashpee, Meeting Street in Dartmouth, New Hope in Attleboro, Self-Help Head Start in Brockton, Town of Stoughton, Triumph in Taunton, and VH Blackington in Attleboro. So that's just this one area, it's what we call the southeast area of Massachusetts. So we'd love to increase the numbers of folks from the South Coast area who are part of this program. And you've already got great resources available, such as this group who brings you lots of great information and educational opportunities. So you can take advantage of that. So we've got those 2 deadlines, so keep that in mind. And, I thought there was one more. Okay, let me mention one other resource that is available from the Working on Wellness website. And that is, there is a toolbox, and you can find this again from the homepage. This toolbox has all types of online resources that you can get access to. So they're free, publicly available resources. There's no commercial resources in this database. And you can search by topical area. So if you wanted to do, you're looking to implement some tobacco cessation policies, tobacco policies in your workplace, you could select by tobacco and it would come up with all kinds of resources and toolkits that are available for you. So I would encourage you to be able to, to go and look at that. It's a great resource. We update it periodically to make sure that, things stay current, and would encourage you to go and look at that toolbox.
What's the website for it?
It's the same one as the mawow.org. Yeah, and it's called the Healthy Workplace Toolbox. So with that, let's see if we got any questions. Yes.
Why the employers are not jumping into this great opportunity?
Why they're not jumping into?
Yeah, into this great opportunity. Why is so very few employers using the resource?
Because it takes work.
Yeah.
It takes time.
Yeah.
And not everybody's willing to make the effort. It takes time to plan. I mean, as you said, why are we doing this? This seems like this is a lot of effort. We just want to get to the interventions and start doing this. People aren't often willing to make the commitment of the time it takes to build a plan. And some would say, without a plan, you're really not going to be able to succeed. So we're finding that that's one of the things. Business cycles, often represent challenge. Having the people, dedicating the time of the people, it's a big contribution. Those of you that are doing this every day, you know how much time. Who was it that said, I want to do more of this. I want this to be my job, right? Yeah. It takes time to do this. So making that commitment, having the resources available, and making that commitment for those resources to take that time out of their workday. If they've already got a day job doing something else, wellness isn't their day job, are they making that commitment to do that? But this really, the Working on Wellness program is a tremendous opportunity. We really encourage you to give it some thought and, see if it's right for your organization. You've got a whole team. There's like 8 or 9 of us that are, almost full-time dedicated to this project. So we've got lots of resources to answer any questions you may have. But it does take time, so you've got to be prepared to make the commitment. In the beginning, it gets easier. Would you agree? It gets easier definitely gets easier as you go along. It's like anything else. You're learning a new language. These are your new concepts. You're learning something new, right? And when you're learning something new, it takes time. I'm leaving on vacation tomorrow, and I've been spending 15 minutes every day during my lunch hour to learn Spanish. And I am 5% fluent. So I can probably get lunch, but that's about it. It takes time, right? And maybe if I'd spent 30 minutes every day on my lunch hour, I would be able to get lunch and dinner and get on the bus. It takes a time commitment. So, other questions?
All right, I was wondering, there are a lot of commercial services, wellness services, whether they're national in scope or, and there's fees. You've worked on a consulting basis with employers through your business. When is it? What do you recommend to people as far as when is it a good time to really think about outsourcing some or all
Great
of your
question.
worksite wellness program?
Yes. I think that's a great question, and I think that's an important part of this planning process, is you need to decide, are we going to build or buy? Do we have the internal resources to take the time? There's a cost associated with every one of your committee meetings, when all of you are pulling together 6 or 8, or how many people on your committee? 8, okay? You take 8 people away from their job for an hour at a time over how many times a month? That takes time, right? So are you willing to, you're going to, whether you build or buy, there's still going to be that time commitment at some level. But it's the extent to which you're willing to apply resources. And there are many turnkey kind of solutions. Like if you just want something that's going to be easy, we don't want to have to do a lot of the work, then just go and buy it. Just buy it. There's lots of available resources. You can find lots of service providers who do a great job with this. But that should be part of your decision-making process is, do we want to build it or are we going to buy it? And if you're going to buy it, you've got to understand what it is you're buying. So there's some rules of thumb about how much you would spend if you were going to buy a program. And they can range from $100 per employee per year to $400 or more per employee per year, depending on the scope of services. So do some quick math, look at that for the size organization you've got. Wow, that's a big budget number. So do I have that, it might take me years to get to a place where I can have that kind of budget number available. So think about that element as well. But build versus buy should be part of your decision-making process when you think about what's the infrastructure it's going to take to run this program. Great question. Yes.
Is there any plan to put forth any sustainability funds? It takes 3 to 5 years to get an ROI. How do you sell that, especially to the town of Fairhaven when we're pretty tight on money as it is? We've got this great program now. We want to be able to go forward with it, but once the seed money's gone, it's going to be tough to convince people to put a budget together.
This is the reason you want to be doing evaluation with your program, is you want to show some results that are taking place as a result of your program. Because, while it's wonderful that we have seed funding available as a one-time piece, it is a one-time piece. So your challenge then becomes how to then build the sustainability in, how to then go and advocate for the budget that you need to run your program, how to work with your sponsor, who's a member of the senior leadership team, to be able to ask that person to be, advocating for your program in the budgeting process. So all of those elements are really going to be important for you to keep your, make your program sustainable. You really, can't just say, all right, we did this for 1 year and now we're done. Because your employees are going to be pretty upset if you get, you get this rolling, you get it going, everybody's having fun, there's a lot of excitement about it, and then the next year you go, oh, we don't have any budget. We're done, no budget. So it's your job to be the advocate for that. It's your job to work with your sponsor to really get the support so that you do have a sustainable program over time.
Is the seed money a match or a reimbursement or a percentage?
So that's a great question. You will find a frequently asked questions document on the website. There's a tab right at the top for questions. And there is a match associated with the program. So for-profit and government entities, we're actually changing in the next two groups, we're changing the match a little bit. And the match can be through either your organization can match the budget. So in essence, the idea was to have some skin in the game from your organization. But we saw for some organizations, especially nonprofits and government entities, that coming up with a match, can take years to go through a budgeting process in a town, right? That they could use in-kind contributions to, some time, and then other in-kind contributions, like if your health plan provides you with certain resources or services, that can be considered in kind. Okay, so anything where there's no cash change in hands can be considered in kind. So take a look at that frequently asked questions document on that. All right, great questions.
Just curious about how the government departments in Massachusetts are responding to this opportunity.
So we've got a lot of municipalities. We've got, I think it's 2 community colleges, Berkshire and Bristol, are both part of our programs. In the original Working on Wellness program, we had a lot of state agencies that were part of that, and we're hoping we're going to see more state agencies in this next group. But absolutely, it's available to any state agency as well. So if any of you work in a state agency or have contacts in a state agency, we actually did a webinar with the wellness champions for many of the through the GIC, through the internal health program, basically for state employees, to attract and encourage state agencies to apply as well. Their employers as well.
I'm not sure if this is true for the Working on Wellness program on the state basis, but I believe that for the program that you can get reimbursed through the state, the wellness,
The small business wellness tax credit.
that part of that cost could be salary cost to someone within your organization who
Right.
has wellness responsibilities.
Right.
And so what's really, I don't know, how many of you actually have your wellness responsibilities as part of your job description? Does anyone? Okay.
Yeah, it does need to be part of your job description,
Okay,
yes.
so that's really important for a lot of reasons. First of all, because you then this is part of what you're supposed to do. And when you sit down with the president of your organization or whatever in your evaluation time, that there's something that says, yes, this is where I spent my time and these are the results that we accomplished. So it's part of making, giving credibility to what you do, is having as part of your job description, but also it can work towards getting funds, from the state if they can allocate a portion of your salary to the wellness program.
Right.
So something to consider.
So for those of you that aren't familiar with the small business tax credit, I think we're in the 3rd or 4th year of that. And again, there was a lot of money. There was $15 million a year set aside for this program, and it has not been very well adopted. Part of the reason was it wasn't well publicized in the first couple of years. But this is for organizations with less than 200 employees that have a wellness program that's considered a comprehensive wellness program. So there's things you need to do, having the person with the role and the job description is one of them. And you can apply for up to $10,000, is it $10,000? I think it's $10,000 as a tax credit. So this is only for organizations, generally for-profit organizations, who are paying taxes. There are some really fine print elements around, as we discovered along the way, that there are some nonprofit organizations that pay a certain kind of tax. So that's a question that if you have any concerns about, I can tell you who to contact at DPH about that. But again, we would strongly encourage you, if you've got less than 200 employees, really look at this, because again, this is money on the table. And the number of organizations that are taking advantage of this is far smaller than we would love to see. So it's more money that's out there to help your program. All right, so thank you all. With that, I'll turn the program back to Julie and Andy.